All right, we're changing it up a little bit. I'm putting myself in your seat. I'm getting ready to have plastic surgery done. I'm going in to visit my plastic surgeon, and the question always arises, hey, what questions should I ask? I'm going to tell you some common ones. I'm going to tell you some not so common ones, and we're going to dive deeper into the subject so you're an expert when you go see your plastic surgeon for whatever procedure. I think it's really important to connect with your plastic surgeon first and foremost. I think you pick your plastic surgeon based on patient referrals. Maybe your friend went to this practice, their online reviews, their online ecosystem, what you see on the website, what you see on their social media. I think it's really important. I think that's kind of the standard these days. You assess, you make sure that it's a good practice, you go in and you see that surgeon. The first thing you want to make sure is you have a really good relationship and rapport. You want to be able to have an open dialogue with your surgeon and make sure that they can hear you. It's one thing for them to understand what you're asking for, but they need to understand the reality of what brings you in to see them. And I think if you understand those things, I think you ultimately have a better relationship. So let's dive in deeper. What are the things to ask for? One, I think one of the biggest things to find out is how often do you do this procedure? So if I'm getting something done, I want to know that I'm going to an expert. If I'm getting my nose done, I'm going to go to the rhinoplasty expert, and I want them to have done hundreds to thousands. And when I'm talking about not over their career, I'm talking in a particular year. First and foremost, make sure they're an expert in their field. I want to know where they do their surgery. Is it a place where, again, the team knows what they are, what they're doing? I want my case to be like vanilla ice cream. It is perfect all the time, and that nothing unique or different is happening, and I'm going to get standard care, standard treatment all the time. And the analogy is like flying a plane. You want it to be standard, everything goes smoothly as possible, and you want to make sure when you go see your plastic surgeon, if you're going to get your rhinoplasty done or your liposuction, your tummy tuck, they do a lot of them, you're going to the same place, and they have the same team doing this. You want to understand what complications they've seen and what happens if you were to be one of those 1 in a million or 1 in 1,000 that ends up getting that complication. Are they going to take care of you? Are they going to get angry with you? What happens in that particular case? In addition, I put in the category of complications not satisfied with the results. What are they going to say and do if you're not ultimately satisfied with your results? Questions you also should be asking. Who takes calls at night? Let's say I have a complication or question at 11 p.m. on a Saturday night. Is there going to be somebody to talk to, or am I going to be talking to some AI chatbot? So you really need to understand who you're chatting with. Really, really ultimate important. I want to know about recovery. I'm an avid wellness enthusiast. I really want to get back to working out as fast as possible. Like a lot of my patients, they want to know what activities they can or can't do. That goes without saying. You really want to understand the recovery part. You want to know, are garments included or garments not included? What do I need to get? How do I prepare for this procedure? Am I going to have to lose weight? Do I don't need to lose weight? I'm a busy guy. How many appointments am I going to have? Can I do some of these appointments virtually, or do I have to do them all in-house? I don't have time for that. So you really need to elicit what the aftercare is going to look like and what fits your best lifestyle. And if it's a combination of virtual and in-house, that's what I would want. I would want a little bit of both. I want to go to the best. I want to go to somebody who does this all the time. I want somebody who has a very low complication rate, but if they do, they're going to take care of you. I want a place that does both in-house and virtual follow-ups so that I can be seen at my best schedule. And so those are things that I really want to find out.